Joining us now is Dr. Russell Faust. He is the medical director of the Oakland County Health Division. Back with us once again on the MegaCast. Dr. Faust, thanks for being back with us.
Hi, Tyler. Thanks again for the invitation.
Appreciate it. So things are seemingly becoming more and more normal. It would feel like here in Oakland County and throughout the state of Michigan, despite the situation with COVID-19. That being said, we're still very much in a scary spot right now in terms of the spread of COVID-19. The surge that began a few months back doesn't really seem to be showing any signs of coming to an end anytime soon. Where are we with that? And what is the prognosis looking like right now in terms of where this surge may be going and what the timeline could be for it?
Well, I'll tell you, it is a little discouraging. The numbers that I watch very closely are the numbers of hospitalized COVID-19 patients in our hospitals here in county. And we had been down quite a ways, but over the last 2 or 3, even 4 weeks, we just kind of very gradually continued to trend upwards. And that is a concern. And there are many factors involved in that, or, based on many people returning to an in-person work situation, our colleges being back in session and on campus. We have international students back on our campuses. We have international travel back up. And we have, an unfortunate number of people who just aren't getting vaccinated.
We're joined by Dr. Russell Faust, medical director of the Oakland County Health Division, joining us on the MegaCast. Let's continue on the vaccine front. Because part of the issue is that, like you just finished with on that previous point, we're still just not seeing enough people going and getting vaccinated. Where are we in Oakland County in comparison with the rest of the state and the rest of the country on our vaccine front, and where are we still lacking in terms of parts of the population that have not gone to get vaccinated just yet?
Well, I'm glad to say that we're in pretty good position here in Michigan, and we're in very good position here in Oakland County. So we can be very happy about our seniors. We're at 90% vaccinated in 65 and over. So that's great news. In the 16 and older group, and you can see I'm cheating here, I've got my little cheat sheet. We're at 76.1% vaccinated. And in the 12 and older, we're at 75%. That's all very good. Where we really need to focus right now, unfortunately, we now have access to this vaccine for the 5 to 11 range children, because we know that though children are less susceptible to severe illness from COVID-19, there have been nearly 2 million children ages 5 to 11 who've tested positive during this pandemic. More than 8,400 have been hospitalized. And so kids still can become severely ill, can still die from COVID-19. And they are also susceptible to something called MIS-C, or multiple system inflammatory syndrome of children. And this can be devastating. And certainly many of those kids have died from those infections and complications. The concern is that children are often only mildly infected, and it's written off as a cold, maybe a mild flu. And despite that, they can be transmitting COVID-19 to their family members or kids at school or teachers or others. And so I think the thought by CDC and FDA, it is important to get this cohort of kids ages 5 to 11 vaccinated. Fortunately, we're very excited now to have the vaccine here at county, and we're partnered with 15 schools throughout the county. And really, one of our goals is to make the children and their parent or caregiver really comfortable in that environment. And so we're doing these vaccine clinics indoors in schools in a familiar and comfortable environment for those kids. We announced it, I think, Friday. We already have 6,400 children registered to be vaccinated. I want to tell folks listening or watching not to be discouraged. If they want their child vaccinated, we'll be able to get them vaccinated. It just won't happen today necessarily. So two places they can go to get their child registered: oaklandcountyvaccine.com or call 800-848-5533.
We're joined by Dr. Russell Faust. He's the medical director at the Oakland County Health Division. All that information he just gave out in terms of where you can sign up for vaccine appointments and call for more information. You can get all of that by going to our website at civiccentertv.com/coronavirus. At the top of the page, the third link on the top line there is Oakland County. I'll take you directly to their COVID-19 page, and right at the top of that page is their nurse on call hotline information, call line, email line, text line, and then quick links for the vaccine hub. All places you can find more information and get in contact with Oakland County for these vaccines. And Dr. Faust, in terms of the greater population and getting more of the greater population vaccinated, how critical is it now, not only in Oakland County, but across the board as we continue to try to inch our way out of this pandemic, to have this demographic of 5 to 11-year-old kids now be eligible for vaccines, where many of our adults that's been available to for the better part of a year at this point now almost, we've kind of hit that full lull right there, and this new population that previously hasn't been able to get vaccinated, now they can. How does that help further bring us along?
Well, again, this will help immeasurably, and I'm really hopeful that this is a great tool to help end this pandemic. And the primary reason is that, again, kids can become infected with COVID-19 and transmit it on, but never really be thought to be ill. Their parents won't necessarily get them tested. Every little kid has the sniffles. They go to school and they pass it on to their teacher or their classmates, and they can pass it on to family members, elderly family members who are especially vulnerable, and it just continues the pandemic. So I think this is an important tool to help end the pandemic.
And then just to speak to some of the vaccine hesitant or some of the detractors of these vaccines, because they were brought through a process so quickly for emergency authorization, and including for the children ages 5 to 11 years old. People will often, when they're detracting from the vaccine or encouraging people against being vaccinated, refer to it as experimental, or we don't know the future implications of this vaccine, and all of that are commonly thrown out there. What do we know about this vaccine to tamper that sort of mindset toward this being experimental and being kind of a mystery and being just one big kind of petri dish that we're all in, instead of it being an effective vaccine that's been well tested?
No, I really appreciate that, the ability to address that. So let me focus on the time to market of these mRNA vaccines. Prior to the mRNA vaccines, Pfizer and Moderna vaccines, the record from start of development to end in clinical availability, the record shortest time was 4 years. These vaccines were available from the start of development to the end in clinical application in 11 months, so basically 1 year. And everybody says, that's evidence of cutting corners. The fact is, this method, mRNA for a vaccine, had been in development for 2 decades previous to this pandemic, and in fact had been developed for Ebola application. And in fact, the mRNA vaccine as a method had been FDA approved for Ebola vaccination for, I think, 2019 had been approved for Ebola. So these were well developed. With regard to the speed to use this as a COVID-19 vaccine, we were very fortunate in that, unlike other vaccine methods, the mRNA vaccine is able to simply take all the method that had been developed, take out the message for a protein, swap in a different message, specifically for the spike protein for COVID-19, and now use that same method. So really the 11 months was really taken up by the clinical trials. Now, most clinical trials are require on the order of something like 3,000 patients to be examined using a new vaccine. there were more than 40,000 patients, 40,000, and the normal is about 3,000. So the FDA, knowing that this vaccine would be under the microscope, that it would be highly scrutinized, more so than any other vaccine in history, they demanded very, very high numbers be in the clinical trials. They did the same thing for the pediatric clinical trials. Pfizer had been had their clinical studies available months ago, and FDA said go back and increase those numbers. So again, the speed to market had very little to do with cutting corners and more to do with an available method that had been already developed for Ebola and other applications. And that's one of the benefits of this method, the mRNA vaccine. It's basically used as a cartridge system, and they can swap it out. Frankly, as a physician that's responsible for vaccinating our population, I'm looking forward to a time when all of our vaccines transition to a message RNA vaccine.
We're joined by Dr. Russell Faust. He is the medical director of the Oakland County Health Division, joining us on the MegaCast. And just to continue on, to address another concern that often comes up with people that are either hesitant to get vaccinated or are against getting vaccinated against COVID-19, they bring up the waning immunity from these mRNA vaccines over time, the need for booster shots or the suggestion for booster shots down the line, and the ability for people to still get infected and test positive for COVID-19, and then bring up the question often of, well, if you can still get infected with COVID-19, if this doesn't give you full protection going forward or it wanes over time, why should I get the vaccine? Can you address that kind of mindset as well, both the flaws in it and why, despite that being the case, these vaccines still can provide such ample protections against COVID-19?
Great questions. Let's start by saying the simple fact that no vaccine is 100% effective. No vaccine in history has been 100% effective. These vaccines, in fact, in the short term, a year or less, have been close to 100% effective, well over 90% for people who are fully vaccinated. What we know about the COVID-19 infection as well as vaccination state is we know the immunology, our immune system's effect against this virus wanes over time. And that's true of the so-called natural immunity that is becoming infected with COVID-19 or the vaccine immunity. Early studies about a year ago demonstrated that natural immunity waned fairly rapidly, somewhere in the order of 3 to 5 months. Vaccine immunity lasts longer, but despite that, as they go back and look at antibody titers, clearly there is some diminution, there's some loss of immunity. So especially for those who have an already weakened immune system, people with cancer or on chemotherapy or a variety, a long list of medical illnesses or ailments, diagnoses, CDC has authorized what they're considering to be a third dose to optimize their immune response. And for the rest of us who are either have maybe comorbidities, are especially vulnerable, are exposed to infection based on our vocations, physicians, nurses, bus drivers, cab drivers, etc. Based on our potential exposure, they have also authorized booster doses. So, I don't have a crystal ball. I can't really project into the future whether this is going to end up being like the flu vaccine. But, right now, I'm thinking it looks like at some point we will require boosters. This is unlikely to be the last booster we see for the COVID-19, unfortunately.
We're joined by Dr. Russell Faust. He is the medical director at the Oakland County Health Division, joining us on the MegaCast. You can learn more information about COVID-19, about the booster shots, about the vaccines for children 5 to 11, and sign up for your own vaccination yourself through Oakland County. But going to our website at civiccentertv.com and clicking on the coronavirus link and then on the Oakland County link, or going to oaklandcountyvaccine.com. That is oaklandcountyvaccine.com. And you mentioned comparisons to the flu shot. That this is a safer method and more effective method than the flu shot vaccine that we get every single year. But we also are in a year now where the pandemic restrictions that were in place and extreme precautions that were in place in the first year of the pandemic are by and large either severely reduced or out of the cards altogether. That's reopening the possibility of a resurgence of the flu, a seasonal flu this year in comparison to last year. How much more important does that then make continuing these precautions and not only getting vaccinated against COVID-19, but also the seasonal flu in 2021?
Thank you so much for that, Tyler. It's as if I've sent a script to you. This is a very important point. I really appreciate it. The fact is, as people are loosening up those restrictions, people are back together face to face. As we're entering the usual cold and flu season, we're all coming indoors instead of having meetings outside. We are going to be exposed. We've seen a number of other respiratory viruses peak in the last month or so. We expect to see flu do the same. So people should get the flu vaccine. There's no reason not to get your booster or your first or second dose, if it's that, of the COVID-19 vaccine at the same time. You can get them at the same day, simultaneously. Just go ahead and get those. The big reason is this. If you happen to get co-infected with influenza, flu, and COVID-19, your risk of death is more than 6.5 times greater than if you're just infected with flu or just infected with COVID-19. This is a big reason to do this, and it's regardless of your age. I want to say a little bit about flu because this is one of the myths that's circulating on social media. I keep hearing that COVID-19 is no different from flu for kids. And the fact is, children with COVID are hospitalized at about the same rate as children with flu. But when children are hospitalized with COVID, they are much more likely to require ICU care and much more likely to require intubation and ventilation compared to kids hospitalized with flu. And note that the COVID-19 vaccine is safer and it's much more effective. I wish the flu vaccine were 90 to 100% effective. It's just not. So I think this is a great vaccine.
We're joined by Dr. Russell Faust, the medical director at the Oakland County Health Division, joining us on the MegaCast on your radio homes for the show, 89.3 WBLD Orchard Lake and 88.1 WBFH Bloomfield Hills. So Dr. Faust, just another few minutes with you before we'll say goodbye today. Anything else that would be important for our audience to know on the COVID front, on the flu front, or other public health information at this time from Oakland County?
Yes, and we're very grateful and excited to be not only here in Michigan, but here in Oakland County and be able to provide these vaccines for everybody's kids. Don't give up hope. Don't be frustrated. Get vaccinated. And again, thanks so much, Tyler.